Today, I would like to shed some light on skilled nursing staffing's effect on patients, therapists, and even their own staff, and why you may not want to go into skilled rehab as a patient or even as an employee. What happens if you have experienced an injury and require more time to heal and strengthen to be able to return home? First, I hope to inspire you as a potential guest, and trust me when I say this, it is not a vacation spot. So I would like to inspire you to take care of yourself. Avoid becoming physically weak, which increases your risk of an injury. Second, if you're already there, I hope to inspire you to buckle up, suck it up, and do your best to meet the goals you need to get yourself back home. Third, if you are a therapist or thinking of becoming one, you need to know why there never seems to be sufficient staffing and how this affects your ability to help your customers get to their goals. Fourth, if you're thinking of going into nursing or becoming a nurse's aide, you need to understand how you may be doing the work of 2 or even 3 people. Ugh. You know, it saddens me when the public media portrays the lack of help in these medical fields as people being part of the quiet quitting or the great resignation, like people are just lazy. That is not even close. Hello, YouTube. One of the main contributors of anxiety, annoyance, frustration, and unhappiness in patients during a rehabilitative stay in a skilled nursing facility is, in my opinion, the number of staff available to help you when you may be at one of the worst possible moments of your life. My name is Lucy, and I have worked in skilled nursing facilities for the past 10 years as an occupational therapy assistant. Today, I want to explore how facilities are staffed and why it may seem that skilled nursing facilities do not have enough staff to meet your needs, how it affects patient progress, and if you work in a facility, how it can affect your job. So stay tuned. Welcome back. And let's dive into how facilities decide how many staff personnel are needed to help you with all the assistance you need, because that's why you're there as a patient, right? As a patient, you're there because you're not able to do everything that you need to do for yourself, whether it's getting in and out of bed, dressed, walking to the bathroom, standing without support, even getting in and out of your own home. At the federal level, the only staff requirements are for Medicare and Medicaid certified nursing homes. That requirement currently states sufficient staff to meet nursing needs of their residents, and they must use the services of a registered professional nurse at least 8 consecutive hours a day, 7 days a week. Now, I don't know about you, but sufficient seems very subjective. Like I could think 10 is enough, and someone else may think 1 should be sufficient. According to a study published in the National Library of Medicine, most nursing homes do not provide sufficient staffing to ensure basic quality of care. More than half of U.S. nursing homes were found to have lower numbers of registered nurses, certified nursing aides, and total nurse staffing levels than those recommended by experts. And 1/4 of nursing homes had dangerously low staffing. Overall, 75% of nursing homes almost never met the Centers for Medicare and Medicaid expected nurse staffing levels. Federal guidelines do not require any patient-to-staff ratio, so this seems really open to opinion to me. The federal government leaves the ratios to each state to provide guidelines for staffing. In researching state guidelines for staff-to-patient care, I came across a website that summarizes each state's requirements or lack thereof. And I say lack thereof because around 16 states have no minimum requirements. So the sufficient staff is left to subjective determination. Now, I have spot checked a few states, but not all 50, so due diligence is due on your part as well. But the few I did check were all accurate. So I'm going to leave a link in below to the website so you guys all have this, can look up your own states. Some of the states that do not have any parameters in place are Arizona, Indiana, Nevada, and Utah, just to name a few. I live in Michigan, and Michigan and 34 other states do have direct care staff ratios. But be aware there are some shenanigans going on that you need to be mindful of. A lot of states have requirements for direct care staff for registered nurses and licensed practical nurses. They also have another requirement known as hours per resident per day, or HPRD, which consists of nurses and aides. In Michigan, the direct care staff ratio is 1:8 on days, 1:12 on afternoons, and 1:15 on nights, in addition to the HPRD. This means that during the day, there should be one nurse for every 8 patients, afternoons, one nurse for every 12 patients, and midnights, one nurse for every 15 patients. Now on to the shenanigans. Every facility has administrative personnel, such as managers, directors, assistant directors, and so on. A lot of these management personnel are nurses, and they are considered in the numbers of the direct care staff ratio. Even though these nurses may seldom attend to patient care, when it comes to the numbers, it seems there must be a near catastrophic incident for them to step up. Now, I'm not saying they do not work, because Monday through Friday, there are meeting after meeting after meeting, just trying to keep up with the short stays that Medicare has going on since the change of Medicare rehab rules in 2019. I also understand that this is not fair to people coming in for the care that they were promised. The HPRD, or hours per resident per day in Michigan, is 2.25 hours. This hour per resident per day is calculated by dividing the total number of nursing hours worked by the total number of patients in a facility. That is only 225 hours for 100 patients in a day. Facilities will work 12-hour shifts, which would be 18.75 staff members for each 12 hours. Now let's start subtracting the administration staff. -1 for the minimum data set nurse, -4 for the nurse managers, -2 for the director and assistant director of nursing, and likely 1 or 2 more management labels that I didn't even think of. Now we're down to 9.75 staff personnel for 100 patients because all these other people are in meetings, right? This could be the reason so many people are frustrated when they need to go into skilled inpatient rehab in a nursing facility. This is like 50% less than the state care standards are. On top of that, this state implied staff ratio is a general number for every facility and does not take into consideration patients that require a high level of care, such as quadriplegia. Now, I get there are managers who will say if you will ask, they will come help. But time is of the essence here. When you must run down help, run down equipment, it all takes time. Time is what Medicare is cutting on these patients, and when facilities are reporting meeting these already meager standards, then 50% of them are then doing administrative duty. It puts a strain on employees and patients. I'm telling you, you need to read my book, The Skilled Nursing Home Trap and How to Avoid It. You'll find actual case examples of people who came in, who should have been able to return home and never had a chance. Not just due to low staffing, but the short stays and the new Medicare Advantage plans are exercising. Advantage plans use averages for your stay as well. So if the average for your diagnosis is 1 week to recover, you get 1 week and you'll have to fight for more time. But then Humana couldn't have a record year in 2022, could they? Now, how does this affect a person's ability to recover in a week? Not so much. First, if you're not able to do much for yourself, the therapist may be spending much of their time just getting you up to the bathroom, cleaned up and dressed. Now, how does this affect your rehab? You may not even make it to the therapy gym to strengthen your muscles. This goes for both physical and occupational therapy. How does this affect the therapist? The patient becomes agitated that they're not progressing because the therapist needs to do most of the work a nurse's aide can be doing. I have seen job postings for occupational therapy assistants to work as nurses' aides so they can do the work and bill your Medicare dollars for the same work the facility should be providing for you. Most therapy is provided by contract companies, so no one seems to want to bring this to light because then the contracted company stands to lose their contract. I'm telling you information that people don't like to talk about, like maybe if no one says it, it's not really happening, but it's happening every day. If you're thinking of becoming a nurse's aide, there are a lot of last-minute call-offs because you're doing the work of 3 people. Not just your job, but covering the call-offs, the management that is counted as part of the direct care staff that are in multiple meetings, and so on. When a patient is on therapy's caseload, they seem to be left for therapy to figure out how to get them up and ready, which takes a big bite out of your rehab time because as a patient, your time is limited with therapy. That's just Monday through Friday. According to a study from the National Institute of Health, weekend staffing is much lower than weekdays. Not just lower, they stated much lower. Registered nurses are 42% lower on weekends, and nurses' aides are 17% lower on weekends. I mean, does this even make sense? People still need to get showered, dressed, go to the bathroom, and eat meals. Or maybe as a patient, you go to the bathroom 59% less on Saturday and Sunday. I don't know. As a rehab patient, that's less help for you, and if you're a nurse's aide, even more work for you. With all the management counted into direct care Monday through Friday and not performing direct care, it just appears that every day is 42% less staff than what should be provided. When the new payment model went into effect in 2019, it was mandated that therapy should be provided 7 days a week. As therapists, we were told it was to get patients to meet their goals more quickly, and this does hold some water. What makes a therapist's job even harder is now on weekends, you're likely doing more of what the facility should be providing and less rehabilitative services. Now, I have had patients agitated when you waltz in on a Sunday when a patient may have just planned on spending the day sleeping. I'm sorry, but it just seems the system is becoming less and less about the patient and more about who they can get to do someone else's job. As a patient, you don't want to go to skilled nursing for rehab. And now with the change in insurance coverage, you're at a risk of circling a financial drain. Now, I don't know about you, but I'm doing everything that I can to stay out of the trap. I'm going to leave a link to Medicare's Care Compare page where you can see the ratings of facilities and review staffing information. The Medicare Care Compare page will show you each facility's staffing in hours per resident day in addition to the state's average and the national average, along with the star rating from 1 being much below average to 5 being much above average. Medicare Compare does not tell you the state's requirements, just the average reported for staff ratio. But I will also leave a link to the resources I found in all the states, and you can look up your own state from there. You need to take care. We need to take care of ourselves. We need to exercise and support each other. This is the information age, and we need to get our minds to know as much of what is happening around us as what can also happen to us. We need to shift our focus to setting up our future so no one loses that independence. Not only do we need to keep ourselves physically strong and mentally strong, but the place we call home needs to be able to age with us as well. My book, The Skilled Nursing Home Trap and How to Avoid It, is available on Amazon in addition to a new ebook that I just came out with called Unlocking the Mystery of Pain for Nursing Home Care. I truly hope that this has inspired you to avoid the skilled nursing home trap. Please subscribe to my channel, hit the like button, and leave me a comment. And thank you for watching. Take care.